Hello everybody. We'll be today discussing regarding the children with fever who are more than 5 years. I know fever is scary, but not always we have to worry about it. So I will discuss about some of the points that you need to be very worried. Like if you think your child is very pale, very mottled, feels abnormally cold to touch, or has blue lips, or severe breathing difficulties, has feet or seizure, extremely agitated, confused, lethargic, and there is a rash appeared, which with pressure not disappear by glass test. With a glass you can press on the rash and can see whether it disappears or not. So if you think these are all or some of them are there, so please you need urgent help and go to the nearest emergency department for with your child. Now, if that or features are not there, but some of the things like some difficulty in breathing, seeming that a bit dehydrated, means sunken eye, drowsy, not passing urine for more than 12 hours, very, a bit drowsy or irritable, not settling with that usual things that you give like toys, television, maybe iPad or food, or picking up that even that is looks very drowsy, very irritable, as extremely shivering like this, and complaining of muscle pain, chicken pox now had chicken pox, but it now getting worse or something like that. Then swelling of the limbs or joints, so cannot stand like for pain, so there is swollen eyes, and more than 5 days of fever or more than 38 degree, then I think you have to call GP surgery or NHS 111. So they will give you advice regarding your child. Now, if none of these features is in between, you giving, you can see is able to drink, passing urine, and when you're giving some fever relieving like alcohol things, is fever is coming down, eating, drinking nicely, in between means at least not eating but drinking, okay, passing urine, then you can look after your child at home carefully. Give them paracetamol. It is very important to calm down with paracetamol. Consider if they are not in comfort, not in discomfort, you may not give, but if in discomfort, then give some ibuprofen and paracetamol, and offer some simple food and regular drinks. If they are vomiting, so you have to give very small amount of fluid, very small amount fluid that stay down. And of course you should not keep tepid poncing or fan to cool down the child. Of course daytime you have to keep an eye, and if rash appear, do that glass test, and if they are due for vaccination, please wait until they are very well and notify the school and keep away them until they are not feeling good. Okay, so that is very, briefly that we have what we are telling about the fever. And actually, fever usually gets very quickly, but some of the children can get worse. So regularly you have to check them, mainly in the daytime and also during the night time. Fever extremely common, very common. There is different causes of this, and if they have 38 or more degree of temperature, we can tell, and you measure this with digital thermometer. Viral infection is the common, then bacterial, there will be runny nose, there will be cough, wheezing, sore throat, red eye, all these things. Or if number of households are involved, that is more likely it is viral infection. And viral infection tend to get better on their own and do not need any antibiotic. So basically, I told you about the medicine, only paracetamol, ibuprofen, that is good. Carefully read the dose of the medication. when you're giving this. You can take the help of the pharmacist, they can help you. And we do not recommend any cough remedies for that. So all about this is that fever. I think you can have an idea about it and you can tackle the problem home without much problem if the childs are not well. But if they are well, then take to emergency or call 111 or GP. Hope that will help. And we'll talk about less than 5 years fever next time. Bye bye for today.